And I'm Joanne DeMaria, principal of Museum School 25, and I know I speak for myself and Dr. Salamini, who is principal at Riverside High School, that it is a privilege and a pleasure to welcome you here today as we have much to celebrate. The clinic is a wonderful product of the hard work, ongoing collaboration, problem solving, and in the midst of a pandemic, perseverance. There's much excitement across our parent stakeholders as the Montefiore Health Systems holds one of the finest reputations across the medical field. As of today, we have close to 40% of our students enrolled, even before the doors of the facility have opened. And our learning community understands that physical and emotional wellness are the foundational prerequisites to the work that we do as educators. So thank you, Mr. Michael Sabatino from our Community and Government Affairs Office, Reverend Lopez, trustees, Dr. Casada, our Superintendent of Schools, Ms. Elaine Shine, for paving this path to success for both Riverside and Museum 25 schools. Have a wonderful celebration today. Thank you. Dr. Casada.
Thank you, Mr. Maria. Sorry. Our music teacher are phenomenal as well. We know that as well. They know how to create a lot of good music.
And noise.
And noise as well. So good afternoon, everyone. I mean, we will be out of the sun momentarily, but being that we are with a number of medical friends, I know that you all took care of your suntan lotion and all that stuff so that you are not bothered by this, correct? I certainly didn't do that, but what can I tell you? Well, good afternoon, everyone. I mean, we are so excited in the Yonkers Public Schools about this partnership. We are excited about bringing an important element of education to our young people. We are excited about the possibilities of partnering with a hospital network, with an institution that is renowned and that is truly looking to build communities. And this is what this is about. This is about building communities. And before I introduce some of our guests who will share a few thoughts today, I want to make sure that I say thank you to all of the individuals who are here supporting this work. First of all, I know that you already heard that Mr. Sabatino is representing Mayor Spano, that due to personal reasons is not able to join us, but who is super excited about this partnership as well. Certainly, we have Simra Brandon in the back, representing our incredible leader, Senator Andrew Stewart-Cousin, who's in Albany continuing the important work. We have Georgia Asciutto, who's representing our education chair, and Senator Shelley Mayers. So thank you so very much. Is there anyone else here that's represented our wonderful elected officials? Yes, sir. I'm sorry. Mr. Basemore, thank you, and please extend our gratitude to the congressman as well. So we're going to move forward with this celebration. But before I do that, let me say thank you to, again, to Elaine Shine and John Carr and his team. And Jen, you have been phenomenal at making sure that this clinic is ready to be open today. So thank you very much. And please put your hands together for John, Elaine, and Jen, because their number one job was to make sure that Montefiore was happy. I have to tell you, and they did it, so we appreciate that. Well, let's continue by introducing the president of the board, Reverend Steve Lopez, who has some remarks.
Thank you, Dr. Casada, and good afternoon, everybody. You know, when I was a kid, I didn't have health insurance. I didn't have health insurance, and it was tough for my mom, who had to pay cash whenever I got sick. Sick kids cannot learn. Sick kids cannot eat. This program is vital to the community as a whole This clinic is going to allow our students and our kids to have affordable health care, to be able to be healthy enough to learn, healthy enough to get a handle on life, healthy enough to not have to worry about bypassing the doctor because I can't afford it. So I'd like to thank the Board of Education. I'm joined by Sheila Greenwald and Trustee Gail Burns, who sits on the board with me. Thank you so much for supporting this effort. I'm also gracious to Dr. Rabati in Montefiore, Dr. Casada and his staff for the amazing work they're doing. These community clinics for schools change lives. They save lives. They're very, very, very important. And thank you to Montefiore for networking with the Yonkers Public Schools and making this a reality today. Thank you and God bless you.
Thank you, Reverend Lopez, and certainly our medical team, Dr. Rabati and our incredible nurses are ready to be partners with this health clinic, and we thank you very much for this work and how supportive you have been through this work, as well as Stephanie McCaskill, who's here representing Dr. Rodriguez and the Office of Special Education and Pupil Support Services, and Rod Rodriguez, who are also out there afraid of the sun as well. These people are, or maybe in the middle of the sun. But we really appreciate all of the support that they provide to this work. Mrs. Sabatino, would you like to offer some remarks on behalf of the mayor?
Good afternoon, everyone, and of course the mayor sends his congratulations on completing this program and getting it initiated. All I can say is wow. As a former education chair for the city council, I think we have to realize that health for our children is just as important as the academic work. This is a wonderful, wonderful program, and as I understand, it is the first one out of New York City that Montefiore is working with. And I just have to thank everyone at Montefiore for this collaboration. And we look forward to additional collaborations with our other schools as well. And thank you all those healthcare workers that have gotten us through this pandemic. We could not have done it without you. As I said, the mayor sends his best wishes, and thank you.
And before I introduce our new partners, our Montefiore friends, let me just share a few thoughts about what you will see momentarily. So what we did in the district is we took about $780,000, close to $800,000 of capital funding that the state, through our state delegation, afforded the Yonkers Public Schools via the community school appropriation. And we leveraged those dollars to be able to support 3 different schools to create community-based opportunities, health clinics, and the total cost for the city, together with the funding from the state, was about $2.7 million. So Mr. Carr and his team and our trustees, we truly know how to leverage the dollars that are given to us to create real opportunities. The clinic, the health clinic that we are opening today, cost the district about $810,000. But we also did some additional work. You know, over at Martin Luther King, we took some money and we upgraded the gymnasium, the cafeteria, and the main entrance so that we can create meaningful community environment for our families and our students. Over at Cross Hill Academy, you know, which will be another ribbon cutting ceremony soon, and hopefully partnering with Montefiore as well, we invested $1.4 million to open another health clinic in that particular school, servicing that community. So altogether, the Yonkers Public Schools are going to have fully equipped 6 health clinics in all of our schools, and hoping to open a lot more in the near future. So my challenge to the elected officials, once you see this health clinic, is let's find the capital dollars to open more health clinics to our students. Well, let's think for a second about this health clinic. This particular health clinic will be servicing students and families from Riverside High School, which is right next to us, and Museum School 25. Between the two schools, there are about 1,200 students. Okay? And think about who they are. 90% of them are economically disadvantaged. 90% of them are Black and Latino. 15% of them are English language learners. 20% of them are students with disabilities. And 2% of them are homeless. So together, we will be representing a marginalized community. Okay? We will be serving those young people that are most likely not to receive health care. Okay? So for us, today is a true celebration. Being able to service the young people and the family in a community that requires so much is what really matters to us. And we are so excited that we have a partner, the like of Montefiore, and we truly want to say thank you to them for their commitment to this. So I'm going to ask everyone to put their hands together for a Montefiore friend. And please help me welcome Dr. Andrew Racing, who's the Senior Vice President and Chief Medical Officer for the Montefiore Medical Group. Dr. Racing. Okay.
I'm going to take this off because I'm going to be far away from everybody. And I want you to see how gray my beard is because I've been at this a long time. So, right, Reverend Lopez, Dr. Gonzalo, thank you so much for this gracious invitation. I just wanted to reiterate some of the themes that have already been mentioned, and it's actually quite reassuring to get up onto a podium like this and listen to the people who have come before me speaking to this audience, saying the exact same things that I would say if I had started out. And that is that at Montefiore, we've been in the business of delivering healthcare services for quite a long time. And one of the things that we have learned throughout the course of doing that is to generate a certain degree of humility when you are in the process of giving out health services. And by humility, I mean to say that the health status of any given individual, whether it be a child, whether it be a school-aged child, whether it be an adult, is not really generated by the health services that they receive necessarily. Our ability in the healthcare sector to influence people's health status really only works at the margin. What really drives people's health status are things that are really beyond our control. And one of the most important aspects of that is education. If you were to ask me to predict the health status of anybody, and I only had one thing to know about them, you tell me what their education is, and I will be able to tell you what their health status is going to be. And to have the kind of partners that we have here, partners in the principal, in the superintendent, in the president of the Board of Education, in the elected officials, this, for an institution like Montefiore, is a dream come true. This is exactly the kind of partnership that's going to help us help the families and the students of this school. And the fact of the matter is that you have just heard a little bit about the demographics of the students here. The only thing that makes those people marginalized is us. We've been working over 100 years in the Bronx, and if the one thing that I've learned about working in a place like the Bronx is the strength and the vibrancy and the creativity of the population of people that come to us for their care. We are honored and pleased to be able to engage a population very much like the one that we're used to in the Bronx, here in Yonkers. We think this is not just the future of Yonkers, it's the future of New York State, and it's the future of this country. And we could not be more pleased or proud to be partners with the folks around here doing this. But to really introduce you to the people that are actually going to make this happen, I'm going to step aside now, and I want you to meet the Vice President of the Montefiore Medical Group at Montefiore, Mr. Matt McDonough, who will take us through the team who is going to do it.
Thank you, Dr. Racine. Thank you, Superintendent. Thank you, Principal of School. And thank you for all the elected officials who have been acknowledged here today, as well as the leadership across the school system in Yonkers. I have the distinct pleasure of acknowledging what will happen next. And as we will see the facility and really the elegance of the design of how many things can happen in the health center. But that will happen only with the people that we have here to take care of the students. And what's a real hallmark to me is that I also believe that education and healthcare are so interconnected and so powerful that really that is what's going to change. That's what's going to make the change. And the change starts now as we actually get to open the doors. So I'd like to ask Rosie Chabra to come in and join me. Rosie is so energetic and enthusiastic, and her passion for this work is really infectious. And she believes that and drives that with her team. I want to just take a minute and acknowledge her for all that she's done and continues to do. This is our 32nd school that will open. It's our first in this county and the first in this part of the state. And a path that we've had in the past that we continue to bring to the future will hopefully continue to open only more doors and an opportunity to expand access and care delivery of the highest caliber, which is what we stand for with Montefiore and specifically within our school health program. Now, we have a few key people I'm going to introduce. I'd like to introduce our medical provider, Dr. Lee Ray. Our psychologist, Dr. Eric David. Our LPN, Bianca Baroa. Our outreach representative, Yamilka Hernandez. And our site administrator, Wadiza McCullough. Oh, I'm sorry. Natalio Perez as well. He was hiding back there. I want to also say that each staff that we have who are a member of this team are critical to the success of each of the sites that we have. Everyone plays an integral role in what we do as a team, and the hallmark of this teamwork really impacts the wonderful care that we deliver. So I want to thank the team for taking on this next step, for continuing to advance our care delivery and access here in the Yonkers Public Schools. Thank you all.
I just want to say that we are very excited to open this new site. With every site that we open, we become stronger and we become better. And we really look forward to become part of this great city and also become part of the community and support the community and the children. Thank you.
Thank you, Mr. McDonough and Dr. Chabra. I have to tell you, Dr. Chabra calls me all the time, during the pandemic, letting me know I have appointments for your teachers and your administrators. So they are not only our partners for opening a clinic, they have become part of our community. So thank you, Dr. Chabra, as well. We truly appreciate it. And just, Mr. McDonough, just like you have Dr. Chabra, I also have Elaine Shine that likes to hide back there. But these two clinics would not have been possible without the incredible work that Ms. Shine has done. And certainly now she's supported by my assistant superintendent, Ms. Lisette Colon Collins, who's also here hiding. They don't like to show themselves. They said, no, that's not for us. But those individuals that they introduced, by the way, they will be working here on a daily basis. They're just not Montefiore friends. They actually will be at this site supporting the health, both and mental health of all of our students in these two particular schools, as well as dental support as well, dental services as well, that they will be provided to these young people. So this is a full clinic ready to support the work. But we're not going to take appointments from you. because we're only servicing our students, okay? And that's what's important. So, I know that the mayor sent the proclamation, so Mr. Sabatino and Reverend Lopez join us as we present the proclamation to Montefiore, please. Yeah.
So on behalf of the mayor, on this great new program here in Yonkers, the mayor has is presenting a proclamation, and today, going forward, May 11th, 2021, will be known as Montefiore School Health Program Day.
Thank you. Thank you very much. John Maurice? And I know that Ms. Di Maria and Dr. Salomini brought two young people here who will benefit from this clinic. So I don't know if either one of you want to say anything. This is about you, our young people. So if you don't want to say anything, just come up and let us see you. Come on down, my MBK fellow. You know what the rule is. The rule is to build your social capital. So you got to say hi to all these individuals because this is what about. And this princess, reminds me of my daughter when she was a baby, but now she's 23. You want to say something? Yes? No? No? Okay. So this is about them, ladies and gentlemen. Okay. So this is about our young people. Okay? So what we are going to do now. Say hi to all these people. No? Okay, stay with me. It's okay. Stay away. Because you look like a princess. Yeah? Oh, well. Go with Mr. Maria. She's nice. So what we're going to do is I'm going to ask my principals to please go into the building, lead the press, because this is your buildings, and let them know where they need to be at. We're going to cut the ribbon inside. Because of COVID and all the restriction, we're going to allow a few of you to come with us, and then when we come out, then you can go in and see the clinic. So that makes sense? So right now I'm going to ask the dignitaries that are sitting to please step inside. Please bring the media inside. Okay? Okay, and then...
But I can do it probably with glasses.
So now we're going to inside the school to look at where the clinic is going to be.
Where could it be? Not yet.
Man, I want to go in there and do all this. Okay. I'll let you guys do all your stuff. Hey, how are you?
Slide right in here.
Oh my gosh, it's too cute.
I don't think that's big enough. Yes. I think you need to get a bigger scissor. You got a bigger one? I don't know if I can do it.
You don't think so? Look at how beauteous you look. You always look beautiful. Thank you.
Who's beauteous?
Is my mic beauteous?
Thank you. Okay, so here's what we're gonna do. Here's what we're gonna do. Okay, we're gonna.
So I don't know what's to hold the scissors.
We're gonna open it right from here. Who will be holding with Reverend Lopez and the trustees from Montefiore? Okay. Are we all here? Montefiore, are you here?
You're gonna cut? Are you gonna cut?
Okay. Come to the side over here.
No, but I need to do it with somebody from
You guys will do
Montefiore.
it from Montefiore, okay? So what we're gonna do, they're gonna go inside.
Where's my trustee? Yes.
And then maybe I'll let you in later on, okay?
Ready?
Make sense? So we're gonna count on the count of 3. So, hold on, please. Hold on, stay right here.
Oh, you got it? All right.
Okay, so you're gonna be the first one to
The
win.
other side? Can we come to the other side?
Okay,
Then we
that's
get a
fine.
couple more people on the side.
Okay,
That's why you're
there
a
you go,
good
let's
person. You know
go.
what you're
So we're
doing.
gonna, on the count of 3, because eventually buses will arrive to take the children that are here, and I'm throwing you all out of the school, so you know how it is, because the kids need to be taken care. So on the count of 3, we're gonna cut the ribbon, and then we're gonna see. 1,
Wait.
okay?
You got it? You ready?
1,
Okay.
2, 3.
Hey.
Yay! Okay, baby, go with the picture. Okay, so let's go inside. Okay? For reception here, okay? And I don't remember where the manager, you put everything because.
Hi,
You lead
everybody.
the effort. Okay.
I'm Ladeja McCullough. I'm the site administrator for the health center.
The site administrator will take you around.
So this is the waiting area, so we can start down here. This is real.
Look at this. Wow.
And this is our dental
Serious.
So this is our dental space.
Very nice.
This is very nice. State of the art. Look at this.
George is awesome.
Guys, this is a real clinic.
It is indeed. Did you see the dentist on
Yes.
And this is the nurse's room here. Did you get a look there?
Okay. Yeah. We were on a call together a couple of months ago. Yes, we were. Yes.
I'm sorry. This is our nurse's room. And our school-based health centers, we tend to give a lot of vaccinations. Make sure kids are all caught up. And
This is like a baby hospital.
It is. We can do
They come here and they want to feel everything. Somebody sees this.
fabulous.
Thank you for coming. I appreciate the words you share.
So, how long have you been?
As a CA, I'm
2012.
Yeah, tied up community health organizer. So I have this site, I have our new site that we're opening.
I know
We have a spot for you.
Be well. Take care.
I want to try to get a group shot of the staff here. Sure. We can get
Now, I need to take that.
Yeah.